movements that you struggle with the technique on or think you may be struggling with the technique on?
Squats. Like, not necessarily depth, but foot and hip placement. Range of motion in us.
Sure, let's start there. That's a great one. So I would say a few things to think about. First and foremost, everyone's squat is going to look different, right? Everyone's anatomy is different, right? We've talked about in the past, the length of someone's femur is going to affect how much severity of shin angle they could create. People with longer femurs, not me, but just simulating, in this case, they're going to have to sit the hips back more and sit down with a more vertical shin in their squat. As opposed to people with shorter femurs, they can keep a more upright torso here and descend into their squat that way. So depending on your anatomy, your squat is going to look different. There's a few key points of performance that we want to make sure are hit no matter what it looks like. So first off, you're asking about foot position. So let's say feet about shoulder width to start. Toes turned out about 5 degrees, 5 to 10 degrees right here. So you don't want too much of an external rotation, but they don't need to be completely parallel. So I always say here, move them from, if this is 12 o'clock, go 1 o'clock, go 11, or 11 right here, and start there. Now, in terms of weight distribution, we want about 60-40 front, back to front. So 60% of the heel and about 40% of the ball of the foot. Right there. So most people are too heel heavy when they squat. We still want to squeeze the floor. So if this is my toes right here, and this is the ball of my foot, I want to be pressing this knuckle, the ball of my foot down into the ground, and into my heel gripping the floor. From there, I'm imagining I'm standing on 2 dinner plates and I'm trying to rotate those out. So rotate the knees out, creating external rotation there at the hip. Here, taking a deep breath in, belly button's pulled in, core is braced. Now, to initiate the squat, we want it to be more hip dominant to start, and then more thigh or quad dominant. So it's going to look like this. From the lateral view here, standing up tall, assuming that position. Here, brace, slight initiation with the hips, so slight tilt back. Now the glutes are going to fire, they're going to work here, and now I'm going to sit straight down between my hips, all the way down to here, right? Now depth is relative to what your body's going to allow here, but for me, this is pretty good depth and tension. I don't want to be down here, campfire squat. I want to be here. I still have tension in the glutes, tension in the legs. Here, to rise out of the bottom of the squat, I'm going to rip the floor apart, try to rip my feet apart, and drive myself up and through, finishing right there, like that. Now, one thing you want to watch out for is this. We don't want to initiate with pelvic tilt, so I don't want to do this. And then sit back, right? If my hips go back, my chest must come down because they're connected through my core. So this is bad, sitting back, versus this is good. Here, tilting, chest drops, hips come back. Now, sitting straight down, split the floor, drive up right there like that. Here, breathe in, hold, descend, 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 split the floor, drive up right there like that. So that's from the lateral view right there. From the front, things we want to watch out for as we descend. We have our good position here, braced, sitting back, initiating, feeling the glutes load, sitting back, sitting back, sitting back. Especially as we come out of the bottom of this squat, we don't want this to happen, right? That knee valgus, that diving in right there. So again, think about ripping the floor open, driving the knees out while keeping the foot flat on the floor. Right here, sit back, sit back, sit back. Knees push out, ball of the foot stays secure, drive through the heels, push the floor down away from you, right? So don't think about standing up, think about leg pressing the floor down away from you. A little bit different cue, but that's gonna cause the glute to fire more, get true hip extension from that squat, like that. Does all that make sense?
Yes, it's super helpful.
What do you feel like is missing sort of from your squat specifically that may have been covered there?
Ooh, I think I have a lot of that have to address. Feet too straight. I think one time I read one play, shoot your glutes out, like fire your glutes out, and I think I might again be overdoing it and doing that pelvic thrust instead of thinking hips and chest moving together. And then you always hear a lot of jargon about like ass to brass, like depth no matter what, depth is the most important thing. And so maybe I need to rethink that. I especially imagine if you're sacrificing form just to go lower and start to collapse.
Yeah, I think the point is, do you have tension in the bottom of the squat? Like, are the muscles still firing? And is there still tension? Right, because like...
So you wouldn't want to just sit in it.
No, you want to remember, think of it as like an elastic band. You're creating tension by descending or eccentrically loading, descending into the squat. So that descending period is building up the capacity for the rebound out of the squat. You don't want to just release all that tension, because now not only are you at the bottom of the squat, but you have load potentially on your body if you're doing a goblet squat, a back squat, whatever it is, and now you're going from 0 to 100 to reinitiate up with a compromised spinal position. Here, you're neutral in the spine, right? But at the bottom of the squat, you could have some pelvic tilting going on where your L5 and S1 are tilted. Now you're going to go from 0 to 100, no brace, boom, up. That first joint initiation is going to cause some issues right there. So that's something you want to be mindful of in the squat. So another cue to think about, I know I have shoes on, but your second toe out from the great toe, that's when you want your knee to track over. So we don't want our knee out here, too much external rotation. We don't want valgus in. We want it right over that second toe. So here's a few things to think about. If you are leaning too much forward in your squat and you're having this issue, you're getting tipped forward, you might want to check. Spend some time mobilizing your calves. Do some eccentric calf raises to get some stretching in there. Because what happens if your hips aren't, if your calf is tight, when I come down, see this vertical shin right here? I can't transit it forward. I end up, my torso has to come through. It's just physics, right? So, but if I'm able to transit that knee forward and flex through that calf and that ankle, see how much more upright my torso can be than driving out and more efficient in the squat. So people that were dancers, track athletes, wear high heels a lot, they have issues generally dorsiflexing that ankle, and that can be an issue. A good way to test that, squat in front of a mirror, look at your torso angle, take 2 5-pound plates, put them under your heels. If your squat is fixed, that's probably the issue. You need to spend some time on your calves, like that. If you have a lot of knee valgus, the knee diving in, reinitiating from the squat, this muscle back here, glute medius, is probably a little weak or underactive. So grabbing something like this, a mini band, throwing it around, doing exercises like clamshells, lateral walks with it around your shins, and then also enforcing that good pattern. So squatting, wearing the band with tempo. So 3, 2, 1, driving back up, 3, 2, 1, driving back up out of the hole. So imprinting sort of that range of motion and movement there is important as well. So this is a universal pattern because this applies to overhead squat, back squat, front squat, goblet squat, whatever form of squat that you're doing, you're going to use these squatting mechanics. And again, everybody's anatomy is different, so these movements and motions are relative to sort of me having shorter legs and shorter femurs and keeping the torso fairly upright, but universally you want to think about creating tension, staying tense at the bottom, things like that. Does that make sense?
Yes.
Awesome, awesome. All right, what's another movement that you've had some questions or struggle with a little bit?
With an overhead shoulder press, like where should it start from and how much depth? Like how far do you go below the line? You're always pushing up here or are you dropping it down?
Yeah, let's talk about sort of that like overhead position. So first of all, let's talk about like the requisite range of motion you should have to go overhead with the barbell. So raising your arm up over your head like this is called shoulder flexion right here. So you need a certain amount of shoulder flexion in order to be able to raise the bar over your head safely. So my rule, take a deep breath in, here, raise your arm up, keeping the rib cage down the whole time. If you can't get your elbow pit, even with your ear here, then you don't have enough range of motion to go overhead with the barbell, right? Because what's gonna happen, the common compensation is, oh, my arm only gets to here, but I need it to get over my head, arch the back, right? Now I've moved through that thoracic spine, it's gonna go down, I put my lower back at risk because of that rotation underneath, like that. So you wanna make sure that you have that requisite range of motion here to reach up. Good way to do it, lean up against the wall, knees bent slightly, lower back stays flat. If you can touch your fingers to the wall, you're probably good to go for overhead prep like that. So in terms of the height, we grab a barbell right here. So for our front rack position, we want to be here. All right. So you'll notice that my forearms are vertical, right? So I'm not forward and they're not horizontally angled here. The reason for that is efficiency of press. If they're forward, I'm going to push out. If they're elevated here, I have to push it forward, then drive the bar up. So we want to be here in the front rack. So my elbow is aligned with my torso here, my rib cage is down, my wrist is neutral, right? It's not bent back here, wrist is neutral, like that. So generally I would say, to answer your question, down to the top of the collarbone, right here. When we're pressing in an overhead position, our first thing that we need to do is get our chin out of the way. So we don't want to lean back because that's going to put pressure on our spine. We're actually going to tuck our chin back. We're going to say, give yourself a double chin, pull back right there. And now, driving through the floor, heels rooted in the floor, now I can press up and into that position right there. And then slowly, notice the elbows lead. Elbows come down first, back to the position, as opposed to letting them roll into the back there. So keeping them underneath here, drive up, here, down slow, elbows controlled right there. So big points of performance, feet rooted into the ground, butt is squeezed, rib cage is down, right, not flared back here, up, back down right there like that. One major fault here, leaning back, or pushing yourself away from the bar like that here, chin tucked, drive up, elbows lead, right there like that for the press. When we press horizontally, as a bench press or a push-up, or vertically, we always want to move in to out. So I don't want my elbows to flare as I press. I want them to move in to out. So I'll show you what that means with the barbell. So here in this position, I don't want to be like this, pushing out here. I want to be here, almost like I'm making a V. Drawing the V, up, right there. So as I raise my arms, I'm going like this, as opposed to this, as we go through. The reason is that as we open up space in the shoulder, we create that space, we create instability. When we stay tight, we're compact or close in that joint where it sits in, we have more stability, more strength, and more safety. Like that. Does that kind of answer your question?
Yes, yes, that was important.
What faults or issues do you see with your own shoulder press?
That forced straightness, I would say, versus what you're just saying about being okay with the V, embracing like a V.
Yes, yeah. So think in to out, like that as you press. Here, right there like that. Yeah, absolutely. Yeah, so if you do your test, your flexion test, and you're like, I just don't have it, I don't have the requisite flexion, couple things you can do. One, you can grab a dumbbell, and you can do a tall kneeling right here, or half kneeling rather, dumbbell press. So we're going to focus rib cage down, shoulder blade pull back, pinning the shoulder blade, other arm out for stability, heel on the ground here, up, down slow. Down slow like that. That's one way. Now there's something called a landmine, which is a lever arm that you can attach into. And this is probably the best shoulder pressing variation. I use this with like 80% of my clients for shoulder press instead, because most people don't have shoulder flexion and they're not going to do the mobility to get it. They're just not. It's time consuming, it's a lot for them, but they still want to work on shoulders. We still want to train the vertical pressing motion. So here, you'll notice, based on the lever arm, pushing up, I have more of a 45-degree angle. So I'm not compromising and compensating, but I'm still getting those muscles that I would train in the overhead press addressed as well. So if there's a landmine around, or you can tuck the end of a barbell underneath a dumbbell, then it'll be helpful as well. Like that. So do you have one of those at the gym?
The upper chest too, like incline, bench, a little bit.
Yeah, I mean, ish, yeah. Just I prefer this. It's a little more vertical than an incline bench ever could be, because you're pressing. Your starting position is here, right? So you're essentially doing like this, as opposed to the incline bench is going to lean you, so it's going to reduce the shoulder angle. So then it's going to be like more pectoral muscle than there, even though like the pecs obviously. It's an adductor, so it brings the shoulder in like that, in that area. So if you can go overhead with the barbell, single arm, half kneeling press, or best, landmine. You know, if you load that bad boy up, you can get like 100, if you can landmine press 100 pounds from the half kneeling position, you're in good shape. That's a good deal, like that. So does that kind of, those are some scaling options, so those are always good for our vertical pressing in there. What are some other moves that have kind of been a challenge in the past?
Movements that have been a challenge. I mean, it seems straightforward, but do you have any tips for pressing, for bench pressing?
Yeah, absolutely.
To like kind of engage the shoulders and glutes and sort of press with an active body.
Yeah, absolutely. So it depends how you're going to approach the exercise, but this is a generalist, because there's like a powerlifting approach where you're trying to produce maximum force regardless of muscles activated. Then there's more of the bodybuilding approach where you're trying to use the exercise to build the pecs, right? So this is my like in between safest like shoulder longevity benching variation. So in terms of the width of your hands, I would always say touch your thumb to your shoulder if your biceps aren't too big, right? Thumb to shoulder, reach the hand straight out. That's a pretty good width for the grip on your barbell. Now, in terms of pressing, we need to think about using the entire body, right? And that starts with the foot position on the floor. So our glute on our right side connects to our lat on our left side here and vice versa through these two spiral lines. So the harder we're able to stabilize this, the harder we can stabilize this, which stabilizes the shoulder, which means we can produce more force at the point of contact. So the glute's fired by extending the hip, so you push the heels into the ground hard. I'm sure you've seen people before, they're struggling on bench press and their feet are going all over the place. They're done. They lost all their force, right? So it's almost counterintuitive, but driving your heels in harder is gonna help as you go to press up. So I'm gonna show you with this barbell right here. This guy. So I'm gonna come back on my bench. Obviously you'll have this coming off of a rack, always use a spotter. Coming back here, first thing that I'm gonna do when I set up, I'm gonna pinch my shoulder blades back and together. Then I'm gonna drive them down. So I'm in this position right here, shoulder blades back and down with the bar here. So shoulder blades back and down. My hips are tilted back, so my lower back is flat against the ground, and I'm driving my heels in hard and pinching my thighs together. So I'm creating as much tension in the glutes as possible, right there. My wrist is fully locked out of neutral. I'm trying to bend the bar like Superman so that my elbow pit is pointing directly back behind me as opposed to flared out to the side. I don't want my elbows to flare, I want them to come down neutral. Now, in terms of mechanics, I'm gonna take a deep breath in, hold that breath in my belly, so breathe in, squeeze my stomach. I'm going to slowly bring the bar just below the chest and just below the nipple line, right here, thinking about pulling the bar down to me, which is going to activate the lats and keep everything tense. To reinitiate and drive up, I'm going to push my heels in the ground and push myself back into my shoulder blades. So not hips up, I want to keep my butt on the bench. I'm going to drag my shoulder blades back into the bench, here, and pop. So slow descent, pull the bar down, drive back, and pop right there. So you'll notice my hips are staying on the bench, but I'm getting that extra drive from the hips here, right there, and driving up as I come back. So for set points, checkpoints, make sure we have 5 points of contact right here with the bench, and that we're going to be driving up and back. So feet on the floor, glutes, both shoulder blades, that's 5 points of contact. So feet rooted in the floor, driving the heels into the floor, making sure shoulder blades are pinched down and back, lowering here, keeping the elbows in what I'd call an A. So this would be a T, we don't want those flared elbows. A right here, down, pressing up and back like that is going to be kind of our checkpoint and checklist throughout there. As you start to come up, places for tension bleed, we talked about the feet flaring out. The other one is going to be the elbows flaring out. So we want to keep the elbows tucked in nice and tight the whole time as well, to make sure that they're making that A as they descend and then come back up. Don't let the elbows flare as you go up, like that. Does all that make sense?
Yes.
Awesome, awesome. Do you have anything about your bench specifically that you think might be challenging you?
Probably the elbows, too flared, too thinking of it in terms of a square, you know, or what would it be, like perpendicular lines versus like...
Yeah, T, A.
It's more natural than
Yeah, and the same thing for push-ups, right? We don't want to flare the elbows out on the push-ups. We want to make that A. So if someone looks at your back when you're in a push-up, it would be right there. The other thing with bench is don't do this. Don't put your thumb down and around the bar. Call it suicide grip. Make sure your thumb is wrapped around the bar.
Okay.
Yeah, because, yeah, I mean, there's nothing to stop it from rolling off the palm of your hand.
Yeah. That would be...
The other thing too, think about your Superman bends iron, like that. You're gonna torque or bend the bar so that your elbow pit faces up right there, that's gonna lock the shoulder in place. So when I go like this and I turn my pinky down, my lat immediately engages. So if you hold your arm out, hold your palm flat like this, put your hand on your lat across your body, now turn your pinky down. You feel how the lat fires? Yeah, so that's stabilizing your shoulders. So we're gonna create that torque, and now when we press, we have that stable position to press off from the shoulder there as well. So remember, everything we're doing with these power lifts or these compound lifts, we are trying to reduce any bleeds of torque or tension except for the place we're trying to produce force, right? Because we have a finite amount of force we can produce collectively in our body, and if we're loose in any other part than the joints we're trying to move for the exercise, that's less force we can produce there. If we're tight here, tight here, tight here, and all the force we're producing is going to go into that bench press. But if our shoulder jiggles and we lose it, that's torque loss. If our foot moves, that's torque loss, like that. So it's always about staying as tight as possible and restricting the movement, producing force at the point of contact, like that. What other moves have you struggled with, or do you have questions about?
Well, I suspect part of the reason I straightened a muscle group is because I was like possibly exaggerating the lockout at the top of a deadlift.
Sure.
So it's like ending the deadlift with like maybe too much of like an exaggerated hip thrust.
Yes.
So what does a good deadlift look like?
Yeah, absolutely. So this is a great segue to differentiate between a squat and a hinge pattern, right? So there's obviously varying degrees in between, but we'll look at the extremes, right? So the easiest way to identify a hinge versus a squat is the angle of shin at the bottom of the movement, right? So a hinge is analogous to a bow, right? So if I were to take a good bow right here, hinging back like this. Now you notice the angle of my shin is very vertical, right? This means that I'm loading my posterior chain, which is comprised of my hamstrings, my glutes, and my spinal erectors, more so than I'm loading my quads. Like my quad is basically offline right now, right? As opposed to, if I were to descend into a squat, note the shin angle and the torso angle. So horizontal torso angle, vertical shin angle. Now, more extreme shin angle, more vertical angle here with the torso. More quad firing, less hamstring, a little bit of glute, right? That's why people are always like, you want a big butt, you gotta squat, until you want a big butt, you better deadlift, right? For most people, again, shin angle, femur length matters, right? So, squat, deadlift, right? Different, okay? So, for the deadlift, this is what we want to think about. Here, our same checkpoint, shoulders, if we're doing a traditional hands outside grip here, shoulders, our feet inside the shoulders, I'd say underneath the hips. So easiest way, what would happen if you stepped in dog poop? You wipe your feet off. That's going to bring your feet directly under your pelvis, right there, aligned. Toes are more parallel than they are with the squat, but still tight, slightly turned out, right here. I'm going to stand up tall, pull through the crown of my head, deep breath in. My posture is aligned, my spine is what we call neutral, so just stacked right here. So, to initiate down into the hinge, I'm going to place my hands down my thighs here, brace. I'm going to think about pushing my butt back. There's a car door open behind me. I'm going to close the car door with my butt. Reaching back, 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 back. Hands descend. Knees will angle slightly depending on my hip flexibility. And here I am. That's about bar length right there. So you'll notice my hips and shoulders are about level. Right here. Hips and shoulders are level, as opposed to the squat, my shoulders are going to be much higher than my hips. Here, hips and shoulders are decently level. So here I'm creating a lifter's wedge. I'm splitting the floor just like at the bottom of the squat. My chin is tucked. I'm not arching my neck, right? Crushing a tennis ball under my chin. I'm going to take a deep breath in, crush an orange under my armpit, squeezing the lats back. And now, to stand up, here's the interesting cue that I find helps clients the most. Push the floor away from you. Drive up, push the floor away, just like you're leg pressing the floor down from you. Here, set, drive through the floor, up right there like that. So with a barbell, it's going to look like this. Here, shoulders back, neutral spine, descending. Here, set, lifting, driving, all the way through. Now you're talking about too much hip extension. Watch how when I stand up here, my shoulders and my hips finish. Right there. So I'm not arching at the end here. I'm not shoulders back, then my hips. Everything's connected. So braced, rib cage down here. Done. Down. Done. Down. done. So everything comes through at once. So if your rib cage is down, called the alligator's mouth, thumb in the belly button, thumb in the sternum, deep breath in, blow it out, close the alligator's mouth. That alligator mouth is closed, your thoracic spine is not gonna, you're stuck. The abs are flexed, they're keeping you down. So when you stand up and you come up here, that's all you got. Your body's just done. So it's a hip extension movement. Here's hip extension. Think jumping right there. That's hip extension, throwing the hips forward. That's the end of the movement, like that with the deadlift, right there. Is that similar to what you were kind of struggling with, that hyperextension or leaning back too far?
Right. I think it was just a feature of like that, you know, specific exercise. I feel like my deadlift form is probably stronger than my squat form or like other things from today.
Okay. Yeah, I would say, think like, I'm even okay if you finish here. Right, with a little bit of thoracic flexion, because the weight might be so heavy it pulls you down slightly. Right? Yeah. So, I mean, obviously, like, ideally I'd like you to finish with this good posture right here, but if possible, yeah, don't lean back, because now, right here, especially thoracic spine or lumbar spine, you're gonna throw it out of whack. All that weight, that force that's pulling down directly on you, from the weight that's stacking the spine, now you're gonna move the vertebrae. So, interesting thing to know with the deadlift too, rounding your back is not bad, rounding your back as you move is bad. Right? So if you think about strongmen, you ever see them lift like the stone? The Atlas stones? Okay, they're lifting the stone like this. Right? So it's like, why doesn't their back explode? It's not that your back is rounded, it's that people round their back once they're moving, and that creates what's called a shearing force. Right? So our spine, if we think of it as an anatomical feature, when we brace, we're essentially stacking those vertebrae on top of each other like this. We're using our internal core musculature to brace and hold them so that we talked about not torque bleed, right? I'm taking force from the ground and putting it into a load in my hands. The spine is what's in between. If the spine moves, I bleed force. That force goes into the spine, the vertebrae shift, and we have a shearing force, which is it's a force multiplier. It's not the same as this, it's many times that going sideways, and that's how people get like a herniated or ruptured disc from deadlifting, right? So, if I'm here and I lift, that's not bad. My spine didn't move under load, right? If I start like this, and then I go like this, that's no good, right? So that's the difference between the two things. So lifting with a rounded back for someone with experience that knows the difference, absolutely fine. Moving, then rounding your back under load, not good for anybody. Absolutely not. Like that. Does that make sense?
Yeah.
Okay, so that's kind of the thing. So with the deadlift especially, think about pushing the floor away from you. Once you've braced here, you took that big Valsalva breath, right there, breathe in, squeeze. Now you're gonna push the floor down away from you, and you're just locking everything else tight. Because it's just hips. Everything else is just along for the ride, like that. Does that make sense?
Yes.
Awesome. Did you have any questions about the deadlift other than that?
Not right now. I mean, just like we discussed, like straps, if you want to go heavy and kind of eliminate the forearm versus like just holding.
Yeah, I would say like generally, because you'll see a lot of bicep tears with the mixed grip, right? So mixed grip is when you take your dominant hand and you pronate it, and then you supinate your non-dominant side. So I would say, if you're a competitive powerlifter in which you're not allowed to use wraps, you should train that. But for most people, you should go double overhand grip on the bar, hook grip if you can deal with it, which is where you roll your thumb under and lock it in here, like a Chinese finger trap, right there. Or if you don't want to rip your thumbnail off, which can happen, just get some wrist straps. Because you're thinking like, are we training the forearms or are we training loading the hips? Right? And most people that are deadlifting and they're like, oh, my grip is going, I'd be like, let me see your form first. Because we could probably get more training effect out of better form at a lower weight than people are getting from just like ripping the bar off the ground with bad form. Yeah, for most people. I mean, there's a point eventually, but I mean, there's people that can hook grip like 800-pound deadlifts, no straps. So it's doable. Yeah, it's not. So yeah, that's with people that have a secure grip and are taught how to properly grip. The hips should be weaker than the grip. That should be what fails first. The hips are the brace in the spine. And they're like that. Yeah, so that internal bracing. What other moves do you have questions about?
I guess I was doing skull crushers recently and trying to figure out like where's a good position for the arm elbow.
Yeah, okay, good question. So skull crusher is a tricep movement, right? So we're thinking like, what is the triceps job? The triceps job is to flex the elbow, right? So the angle of the elbow in relation to the shoulder is gonna affect how much we're using the tricep, right? Because muscles don't work in a vacuum, they work together. Like your body doesn't know what muscles are, it just knows movement. So it's like, if your elbow is here and you reach back, different tricep activation than if you have shoulder flexion and elbow flexion together, right? So we want to get to a point of more extreme elbow flexion. So I don't want to do my skull crushers here, I want to do them here, right there, right? Rib cage is down, lining the bench, reaching back, finding that full stretch here like that, and then coming up. So even though they're called skull crushers, if you have the shoulder mobility requisite to allow you to do it, I would say you actually want to give yourself a haircut with the bar. You don't want to come to the head. Now I'm also a fan of doing them with dumbbells because I feel like most people are asymmetrical. So attaching yourself to a barbell, putting yourself in extreme shoulder flexion, and then a little bit of internal rotation, probably going to cause issues. That's why the dumbbells are a little bit nicer. And I feel like you can manipulate them to get a better stretch as you come back. So coming here, the elbow angle stays the same, especially as you come up, and I'll show you what I mean in a second. So as you come back, imagine that this is resting on something. Here, I'm flexing through, now I'm stretching the tricep as I reach back, 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 back. I always say try to touch the head of the dumbbell to the shoulder here. And now I don't want to roll the elbow forward. I want to keep the elbow in place right there and lock out. So I get this nice 90-degree angle right there like that. Now there is a version of this movement where you do actually use momentum to propel it up. We know that eccentrically we're much stronger than concentrically or lifting. So what you can do to overload the muscle, you can control the descent, then you can create more shoulder flexion rolling back, catapult it up and extend, still stopping at the same point. So right here, back, hit that midpoint and come up. You just don't want to do this, right? So we want to keep that angle right there of the tricep as well. So I'd say dumbbells superior to easy curl bar superior to the straight bar, the flat bar right there like that as well. I'm not a big fan of fixed barbells because the inertia that would be taken, the inertia of the weight coming down, right, is taken up by your joints in most cases. So like your wrists, your elbows, as opposed to a loaded barbell, the inertia is taken up by the weights actually being able to spin. So the load is manipulated through the range of motion, so it's a little bit better on your joints. Yeah.
Do you feel tricep push down, rope or bar also has merit, or do you think skull crushers are like the superior?
I guess the auxiliary question to that is always superior in what way and for what purpose, right? So there's 3 heads to the tricep that are going to get trained differently, right? So like the long head of the tricep is very hard, it's hardest to train, not very hard, but really you have to do something overhead. You have to get the shoulder up here to train it. I think that when it comes to accessory work like that, you have to think, whenever you're pressing, your triceps are doing the work. As soon as the elbow gets past 90 degrees, the tricep is doing a tremendous amount of work. So tricep targeted work, like most people are not tricep deficient. That's, they're more going to be pulling muscle deficient or cuff muscle deficient, like Terry's going to be weak, things like that. But to answer your question about which is superior, I think both have merit and should be used interchangeably. Yeah, so I think the more variety that you can introduce to the program, so periodized variety. So it's like you don't want to do a different thing every day or every training session, but you want to make sure that you're rotating your exercises, your reps, and things like that. A classic periodized program, so that you're constantly adapting and creating new stimulus for the muscle that you're trying to train.
Of course, makes sense. Especially tricep, bicep, because I understand it's different muscle groups combining together, different ways to approach them.
Yeah, absolutely. I mean, all muscles are like that, right? So we have to be careful about we anatomists decided what muscles were what, right? Our body doesn't differentiate between tissues. It's just like, hey, I want you to create leverage at this joint, right? Muscles contract and joints shorten, or muscles contract and joints lengthen. So, you know, like what muscle you're using, like, okay, I'm doing a bicep curl, but my forearm also has to keep my wrist from dropping like this, right? So like the muscles in the forearm are isometrically working so that I can concentrically contract the bicep up like that, right? And depending on the amount of supination in my hand, they're gonna work different muscles in the bicep. Hammer curl versus a traditional curl. In that way, like that. So, you know, that's why variety is so important, and also why the compound exercises are superior to just single joint exercises, because of the recruitment of multiple fibers, right? Like in multiple muscle groups. It's like when you're benching, everything's working, right? You know, like your chest, your shoulders, your triceps are locking out, you're bracing, like things are working as a whole. So you're recruiting more muscle to move that apparatus or whatever force you're trying to push at. Not to say that isometric or isolation exercises don't have their merit, but that's why usually in a program we would put the compound exercises first, because they're going to need the most energy, recruit the most muscles for the exercise.
Sure, makes sense.
Yeah, like that. What other stuff did you have questions about?
Covered a lot. I'm trying to think of anything else comes to mind, or what major movements haven't been discussed yet?
Well, we've done vertical pressing, horizontal pressing, we've done squatting, we've done hinging, we've done elbow extension.
Well, rowing or pulling, will that come down to like close grip, wide grip? I guess generally rowing in general, like how far you stay vertical, do you pull to your stomach? Is there a point for the back? Yeah.
Yeah, let me grab a larger dumbbell so I don't look weak in this video. I only had a 20-pound dumbbell, so I feel like for rows I'll look soft. All right, so with rowing, we want to think about like what we're trying to use. This is a common mistake I see with the dumbbell row, right? People are closing the shoulder and elevating the trap. So when they pull back, they're going like this, right here. And instead, we want to think about sweeping, right? The lat, this big muscle right here, part of what it does is this motion, sweeping back, right? So we want to simulate that sweep with the dumbbell as we come back right here, as opposed to pulling up and elevating our traps, which are probably overactive to begin with. So when we set, we want a good brace here, slight bend in the knee, little external rotation for my hip because of the way my femur is shaped. Rib cage is down, spine is neutral. I'm pushing the bench down away from me. My chest is active here. I'm not collapsing down into the shoulder, right? I don't want to collapse into the shoulder, so I'm staying tall here. I'm going to reach the dumbbell down and forward, getting a full stretch. So I don't want to finish here, I want to get that stretch. And now to initiate, I'm retracting my shoulder blade and sweeping in. So here, as opposed to just pulling up, notice the trap, my shoulders go to my ear. I'm going to pull back right here. But the first move is this, retract the shoulder blade, sweep. It looks like one motion, but that's what I'm doing right here. Retract, sweep. So I'm getting a little bit of rhomboid in the middle of the back. So, bad way to do it, right? Throwing the dumbbell up there, right way to do it. See that sweep of the lat coming all the way down?
It looks very different too. Like what
sweeping the I say aim the elbow for the hip. Right? Now I'm getting that whole side to engage as opposed to just pulling up right there like that. Now that's a fully horizontal angle. In terms of loading it, I think dumbbell rows are better for maximally loading the lat. Because you don't have the challenge of here in the barbell row, you have to bounce, right? And now, if people have low back problems, there's a lot of shearing force on their back, things like that. Here, I have 3 points of contact and stability so that I can really load the lat and go heavy, like that. Now, one thing too, we've talked about using straps before. If the grip becomes an issue, now you're gonna get too much bicep and forearm in there. I would say hook the dumbbell like this. Right? So looser grip on the dumbbell is going to allow me to fire the lat first and not get those muscles involved in much. So I don't squeeze the dumbbell super hard. I keep like a looser grip on it. So it's almost like there's space in my hand around the handle of the dumbbell as I come up here, back. Now you'll notice too, watch my spine on this one. See that, how it's bending? We don't want that. We want to keep here. Brace, everything tight.
Right, really isolate the arms moving, the torso arms.
Exactly, yeah. So main thing is just looser grip than you think you need. Sweep back like that. And you'll feel right down from its insertion point down here all the way up. You'll get the length of it, as opposed to most people are just getting up here because they're shorting it like that. When you pull horizontally, if your shoulder rises, you're off, right? Your shoulder should stay right where it is, as opposed to right there like that, as you come back into the row. So in the gym, kettlebell or dumbbell row, big fan. Barbell row, lesser so again, asymmetry issue, and then also just the limiting factor of like how, some people, they're here and they're rowing. It's a different exercise than being here with this completely horizontal torso. Other machine that I'm a huge fan of is the hammer strength machine with the chest pad and 2 hand levers. The best, because the stretch is just crazy, right, on the muscle as you come out. And then because it's on a lever, it forces you into good position, right? There's no coming up, like you're attached to a lever arm, you're just pulling right here, like that. So big fan of that machine too if you have access to it. Cable rows are great, single arm, kneeling, with the cable right here, braced up tall, pulling back like that, here. And then you get a little bit of anti-rotation from the core as well. Those are variation. Same thing, you wanna make sure you're not shrugging it back, you're aiming the elbow low like that on the way back. Yeah, but big fan of those too. I think they're super effective.
Good stuff, right?
Yeah.
Shoulders down and back.
Yeah, shoulders down and shoulder. Put the pistol in the holster, here, down and back right there, pressing, pulling. Just set like that. Any questions about that?
No, that's super helpful.
Okay, for sure. What else you got? What other questions?
If you're doing an upright seated row, like does the back stay straight and you're rowing just with the arms, or is there movement? I feel, and that might be different when we're talking like a machine row versus like a cardio row.
Oh, like the rowing machine?
Yeah, rowing machine versus if you're at a machine station.
Yeah, I mean, okay, so if you're doing like that hammer strength machine, this is what I would advocate for your form, right? We know that the more range of motion we're able to safely exercise, like the more tension we're gonna build in the muscle, the more training adaptation. That's why full range of motion is so important. So imagine I'm rowing right here, my chest is supported, my torso is gonna stay neutral, but I'm gonna get a little protraction through the upper back, right here, almost like a Ninja Turtle, like rounding the upper back. I'm gonna initiate by retracting those shoulder blades and then pulling into that. So it's gonna be like here, shrugging forward, retracting, pulling. Right there. Turtle shell, squeeze the shoulder blades, pull like that. And that's gonna give you a little bit more range of motion. You'll feel a much bigger effect, especially in the center of the back, like the rhomboids and lower traps from that. So you get that Ninja Turtle here, pull back, squeeze like that on the way back. Now in terms of the rowing machine, it's more legs. So you're gonna drive first with your feet, finish with your arms. So you're gonna push with your feet with the handle out, arm is straight. So push as the leg begins to lock out, then you initiate the pull, slight maybe lean back, nothing super aggressive unless you're like an extreme sprint. So you'd be here, extending the hip, arms are straight, start to pull, lean back, come forward, and then back like that. In there. So you don't want to like lay horizontal back. Some people go way too hard. It's more about, it's a rhythm thing. Consistency of stroke is much more important than how hard you go on each stroke individually with the rower. Yeah, I don't have, the rower's in the other room, so I don't have it with me, but yeah, I can definitely shoot a video on that too, because a lot of people are very inefficient on the rower, they go too hard.
No, sure, no, that was super helpful, because I like both. I barely even have a rowing machine, unless I'm at like now, so. But yeah, no, that's super helpful.
Okay, good. Excellent. What else you got?
I'll probably think of other things. I'm trying to think of like any other.
Yeah, we can always do, we can do endless videos too. I mean, I just, anything that was like top of mind that you've been working on, that's something you're struggling with.
I mean, I do see people with a standing tricep push down. I see people all
slight hinge of the hips here, so you have some space to push the bar down, because you're not going to push it into your lap, you're going to run out of space, right? Like, you should be able to put your hands, retract your shoulder blades. I'm going to run into my thighs, so what I do is hinge slightly here, right there, yeah. You see like people doing this out here like this. Yeah, slightly different head of the tricep, but I don't think the juice is worth the squeeze because you're internally rotating the shoulder, right? You're opening that space in that joint right there, so now you're putting it at risk. So I'd say for me, here, the other thing then you get with that position is people use a little bit of their weight, they're putting their weight into pushing it down, as opposed to when the hips are back, now I'm truly isolating that tricep and just doing a single joint like that. So I would say here, sitting back hips, pressing down on the bar like that. I like the rope because you do get a little bit of loaded internal rotation at the end, just minimal, kind of pulling apart. But personal preference for people too. I mean, supinated single arm handle, great one too. Right there. Yeah, absolutely. Yeah, or you could kneel, half kneeling in here. Just supinated, so the palms facing up, single handle, like one of the rowing handles. Just extend the elbow right there like that. Yeah, so those are some good variations as well that I've used. But yeah, and also like sometimes it's nice to have a bar with some a little bit of like the knurling the easy curl bar as well, just to control the wrist supination or pronation and see where it is angle-wise in there as well. So yeah, but I would say just keep it here with the hips back as opposed to like trying to push down like that. This is not a good position. Thumb down, internal rotation, risky for the shoulder because you're opening space up right there like that, versus external rotation is a safer position. So if you turn your thumb away from you like that, like we were looking at before with the bracing. Yeah, so if you point your thumb up, internal rotation, external rotation like that. Yeah. Exactly. So externally rotated positions are generally safer for the shoulder.
Okay, that's good to know. That's super interesting.
Yeah. I mean, like that's a whole other thing. Shoulder's crazy, but yeah. But generally, yeah, with those things you want to keep in those positions like that. So, is there anything that you found like you wanted to know more about, or was like especially helpful or anything?
All the squat stuff is especially helpful. Like, there's a lot of different voices out there about the right squat, what you have to do, what you don't have to do. So I think being mindful of like your body, like like you said, individual proportions, and that's super helpful. A lot of stuff to clean up, I think with my squats, but I think there's so many components to it too. It's like, you're holding a lot together in your mind, like thinking about where everything should be. So.
Yeah, I think like the main thing to think about is like, do you have tension throughout the movement? Like, is there any anything that's loose at any point? Like, do you feel weak or underactive as you're descending, ascending, places like that? Or is there tension at all times? Or you're splitting the floor open with the wedge, things like that, those type of cues? Like, that would be one thing.
It's huge. I think at some points in this like manic push for like depth no matter what, I just basically sat, like, there was no tension. Like, just stopped because it was really deep, and that's not good.
Yeah, you don't want to just drop in the bottom of the squat. Think about it like, can you stop at any point in the squat and control that point of movement? Like 1 inch at the bottom, can you hold that? 2 inches, 3 inches at the bottom, can you hold it? Halfway up, can you hold that position and have mastery? If you don't have mastery of those positions individually, you need to train those. Like you need to do some tempo squats or something like that.
Oh, well, that's super interesting. And best practices, so you don't get injured or get stuck or something, bad happens. Like, can you hold any one position in a squat?
Yeah, I mean, like when you come down, right? So generally the hole is weak for people coming out of the hole. So can you hold right here effectively? Can you hold here? How about here? Right there. Yeah, it's like, where is your weak point? Because that's where you're going to fail, always. You'll fail at your weak point. So it's like master that, get stronger there. And all that. Jeremiah, I threw so much knowledge at you.
It's so good, always super interesting. There was so much involved, so much, science and physics to it. How our body moves, how we're moving these weights. stuff to think about. Thank you.
Yeah, you're welcome. I appreciate getting to share it. We'll do another one of these. We'll come up with a list of stuff we want to cover in the next one too. And we can even pick like one specific movement and just dive in and completely just dive into that one movement for like an hour, because it's easy to break it down like that. We can get some of the other.
All the overhead stuff, that could just go on and on, different variations of over the head work and what the shoulder's doing. So,
yeah, absolutely. We didn't even cover pull-ups or anything too. So vertical pulling as well as a component, lat pull downs, things like that. So it's good. We have more material for another time.